of mini PERT versus flexible ureteroscopy for stone between 10 and 30 millimeters. Please, Dr. Sharma. You have to go out, and okay, and please, click on it. Okay, perfect.
Hello everyone, I am Dr. Aditya Sharma from New Delhi, India. We evaluated our patient database in last 2 years and we found out that 78% of our cases had stone size between 10 to 30 millimeters. So we started this study with the objective of to compare single puncture mini PCNL with RIRS in this stone group 10 to 30 millimeter in a single sitting. Total 100 patients were offered either mini PCNL or RIRS, 50 patients in each arm, and they were further subdivided in groups A 10 to 20 millimeter, group B 20 to 30 millimeter. Cases which were excluded were RIRS cases which required primary DJ stenting because of the tight ureter, or the mini PCNL cases which required a second puncture. Ultimately, 87 patients qualified for the final analysis, and cases who did not show any fragment larger than 3 millimeter on a follow-up CT at 3 months were considered stone-free. In results, both procedures were compared for patient stone perioperative parameters and stone-free rate. To summarize, for smaller stones, RIRS had lesser analgesic requirement and faster recovery, and for larger stones, mini PCNL was faster with lesser post-operative pain. There were few complications, nothing major except one case which required blood transfusion in mini PCNL group. To conclude, mini PCNL RIRS both are safe procedure to tackle stone between 10 to 30 millimeter. RIRS should be preferred on the basis of this study for less than 20 mm, and for stones more than 20 mm, mini PCNL should be preferred for desired stone clearance in single sitting with lesser post-operative pain.
Thank you very much. You stay in time. Question from the audience, please. Because this is always an unanswered question. Which is better, flexible ureteroscopy or mini PERT? No question from the audience?
I have a short question. Are the stone-free rates for the retrograde intrarenal surgery groups achieved through a single procedure? And if not, was the average number of procedures needed to achieve the stone-free rate status of 94%?
Yes, sir. This stone-free rate is of single procedure, and the endpoint, the objective of this study was not included. The point you asked, how many number of procedures required to make a stone-free, achieve 100% clearance. So that wasn't the objective of this study.
Thank you.
Other question? So please don't be shy, be interactive. Another question from my point of view. I notice 136 minutes of operative time. It's rather long, just because it is mean operative time. Don't you think that it is a little bit risky to perform such a long flexible ureteroscopy? Of course, you didn't have a septic complication, but honestly, it's a very long operative time.
Yeah, I totally agree, because we have to keep access sheet size is a limitation for the size of stone which can be retrieved with the basket. So we fragment most of the stone, and there are many fragments, and it takes a lot of time to retrieve them back. And we work in a private setup. Patients have really expect us to make them stone free. Luckily, of course,
also mine, unfortunately, are expecting to become stone free. Okay, thank you very much.
Thank you.
Thank you. The next speaker is Dr. Abdul Wati.